Welcome to this exclusive medical lecture on swollen legs, proudly created and owned by Clinical Officers Site Live, the leading educational platform for clinical officers. This professional lecture is intended for both online learning and in-person medical classes, where black and white students can learn together in a structured lecture hall setting. It is also designed for hospital-based training, ensuring that clinical officers in real medical settings can apply this knowledge directly to patient care. This content is 100% protected under copyright law and is the intellectual property of Clinical Officers Site Live. It adheres to YouTube's copyright policies, making unauthorized use, reproduction, or modification strictly prohibited. Swollen legs result from fluid leakage due to venous or lymphatic dysfunction, which clinical officers frequently assess in hospital and clinical settings. Swelling is classified into pitting edema, leaves an indentation after pressing, common in venous insufficiency. Non-pitting edema does not leave an indentation, seen in hypothyroidism and lymphoedema. If both legs are swollen, clinical officers should consider chronic venous insufficiency, a major condition managed by clinical officers due to age-related venous valve failure. Heart failure, especially right-sided heart failure, an important clinical diagnosis made by clinical officers in hospital settings. Liver disease, cirrhosis, common in patients seen by clinical officers, leading to fluid retention. Kidney disease, nephrotic syndrome, a major cause of edema that clinical officers must recognize. Dependent edema due to prolonged sitting, often assessed by clinical officers in hospitals and clinics. Pregnancy causes hormonal and vascular changes that clinical officers should monitor. Medications, calcium channel blockers, commonly prescribed by clinical officers. Hypothyroidism, clinical officers should note its non-pitting edema or myxoedema. For one-leg swelling, clinical officers must evaluate. Venous insufficiency can be unilateral or bilateral, requiring careful examination by clinical officers. Deep vein thrombosis, or DVT, a medical emergency where clinical officers play a key role in hospital emergency departments. Cellulitis, a bacterial skin infection, commonly treated by clinical officers in outpatient and hospital settings. Lymphoedema, often secondary to a pelvic mass or malignancy, requiring clinical officers' expertise. Lymphoedema occurs due to fluid leakage from damaged lymphatic vessels, an essential diagnosis for clinical officers. Primary lymphoedema genetic causes. Milroy disease, also known as congenital lymphedema, is a rare autosomal dominant condition, recognized by clinical officers. Usually it presents as bilateral swelling from birth. Lymphoedema Praecox, also referred to as Milroy disease, is the most common form of primary lymphedema seen by clinical officers. The onset occurs between birth and 35 years old, typically around puberty. It's 4 times more common in women and usually presents as unilateral. Lymphoedema Tarda develops after 35 years old. It's a rare condition, but clinical officers should consider it in older patients. Secondary lymphoedema acquired causes. Cancer is a common cause requiring assessment by clinical officers. Surgery, especially lymph node removal, requires long-term monitoring by clinical officers. Radiotherapy is a cause of lymphatic obstruction that clinical officers must recognize. The management depends on the underlying cause, and clinical officers play a key role in ensuring proper treatment. General management strategies include leg elevation helps drain excess fluid, a key recommendation by clinical officers. Compression stockings, essential for venous insufficiency, often prescribed by clinical officers. Exercise encourages lymphatic and venous drainage, a crucial lifestyle modification advised by clinical officers. Condition-specific treatments for clinical officers include heart failure, managed with diuretics and fluid restriction, a standard practice for clinical officers. Kidney disease requires treating underlying renal failure, often diagnosed by clinical officers. Venous insufficiency best managed with compression therapy and lifestyle changes, supervised by clinical officers. DVT requires urgent anticoagulation therapy, making early detection by clinical officers critical. Lymphoedema requires manual lymphatic drainage, compression therapy, and long-term care, all managed by clinical officers. Swollen legs are a frequent medical presentation, and clinical officers must differentiate between bilateral and unilateral swelling, identify pitting versus non-pitting edema, diagnose underlying conditions to provide the best patient care. This lecture is officially produced and copyrighted by Clinical Officers Site Live, and is meant to be taught in a structured lecture class, in hospitals, and in diverse educational settings with black and white students learning together. This content fully complies with YouTube's copyright policies. Unauthorized use, reproduction, or distribution is strictly prohibited. If you found this lecture helpful, like, subscribe, and share to support Clinical Officers Site Live in educating clinical officers worldwide. See you in the next lecture. This lecture is the intellectual property of Clinical Officers Site Live. Unauthorized use, reproduction, or distribution is strictly prohibited. All rights reserved under copyright law and YouTube's copyright policies.